Modern amenities which save energy and time are everywhere, but that also means deviating from the way the human body naturally evolved, leading to problems such as facial deformities. While it's not natural selection, since there is no longer much of a culling off of the weak, and therefore little genetic change in the highly successful human race, a study known as Epigenetics has answers towards why many faces have become less attractive and how this can be naturally solved. Dental Dr. Michael Gelb and Dr. Howard Hindin state in GASP Airway Health, most people tend to agree on a starting point for defining beauty: prominent cheeks, full lips, straight teeth, a wide, strong jawline, and a mouth without an overbite or receding jaw. They mention these issues present themselves with a soft diet, improper breathing, tongue movement, swallowing, and posture, among others. This was also the finding of earlier researcher and portrait artist George Catlin, who had an eye for facial features and compared facial features of Native Americans in the 1850s to those of Europeans. He writes in Shut Your Mouth and Save Your Life, the regularity, beauty, and soundness of their teeth last them to advanced life and old age, noting the Native Americans' closed lips and strong chewing on bison. In contrast, Catlin writes the following about European counterparts. He sleeps with his mouth open during the night, and during the day he has not the power to keep it shut. By the hanging of his under jaw, a counter effort arches his brows, impairing the characteristic expression of the eyes and giving an aspect of indecision and insipidity to the whole face. Modern statistics are further startling. While the American Association of Orthodontists records 80% of American teenagers are currently undergoing orthodontic treatment, Dr. David Lieberman, through examining skulls, mentions less than 5% of pre-industrial humans had teeth crowding only several hundred years ago. Thus, crooked teeth do not have so much to do with genetics as once thought. Instead, epigenetics, which involves how DNA is expressed in the physical body of the organism, is more to blame. Dr. Michael Gelb and Dr. Howard Hindin go on to describe how space for teeth and airways develop lower, back, and smaller with mouth breathing and improper posture, and play a major role in sleep apnea, among other mental disabilities, as the oxygen delivered to the brain is insufficient. Because many are now habitual mouth breathers and our ancestors ate a more tough paleo diet, crooked teeth and disfigured faces have become epidemic. It has even been found the lack of breastfeeding and move towards bottle-fed infants, as well as the position of the tongue away from the roof of the mouth, where it acts to properly shape and round the palate, disfigures the natural shape of the roof of the mouth. So what can be done about all these issues? Though it is not easy to make certain changes, as physiological changes, such as in the blood and skull, can make change very uncomfortable, shifting towards how the body was meant to function provides wondrous benefits to attractiveness, self-confidence, and health. Myofunctional therapy is an approach which aims to properly train the underlying muscles of those afflicted through certain facial exercises, constant nose breathing, and mouthpieces, and can, in many ways, be performed at home without assistance. Unsure if your mouth is closed while you sleep, snoring is a key indicator and involves airways being pushed back and blocked. If you cannot fall asleep with a closed mouth, it is further indication. Natural beauty and extraordinary benefits from airway health require patience and constant maintenance, but it's all worth it for that brilliant smile.